The term addict is defined by California law and U.S. federal law. This educational video reviews the legal definition of the term addict, as well as medical definitions of the term addiction. The California Uniform Controlled Substances Act defines addict in Health and Safety Code section 11156. The definition of addict requires two elements, craving and use. Use is impaired control over drug use, compulsive use, or continued use despite harm. The combination of craving and use characterizes an addict under Health and Safety Code section 11156. There is an exception for drug-seeking behavior that is primarily due to the inadequate control of pain. Health and Safety Code section 11156 makes it illegal for a physician to prescribe a controlled substance to an addict. A physician shall not prescribe a controlled substance to an addict. The consequence to a physician who prescribes a controlled substance to an addict is a criminal conviction, misdemeanor, or a felony. That's California. Looking at the U.S. federal level, the Controlled Substances Act in Title 21 of the United States Code section 802 defines addict as a habitual user who endangers public morals, health, safety, or welfare, or demonstrates a loss of self-control. So California state law and U.S. federal law both define addict. Now let's look at the National Institute on Drug Abuse, NIDA. The National Institute on Drug Abuse is a federal agency. They're a federal scientific research institute under the U.S. Department of Health and Human Services. NIDA is the largest supporter of the world's research on drug use and addiction. NIDA provides a definition of addiction. The elements of NIDA's definition of addiction are brain disorder, mental illness, medical illness. Addiction is a chronic, relapsing, severe condition characterized by compulsive drug seeking, repeated and continued misuse despite harmful consequences. The American Psychiatric Association also provides a definition of addiction. Addiction is the most severe substance use disorder, SUD, and is characterized by uncontrolled use despite harmful consequences. Now, the American Psychiatric Association also publishes the authoritative Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. The American Society of Addiction Medicine provides a definition of addiction, and I noted that there are 7 C's in the definition of addiction provided by the American Society of Addiction Medicine. Condition. Addiction is a medical condition. It's a medical disease, a mental disease, a brain disease. It's chronic and it's complex. It's a complex interaction of brain circuits, genetics, the environment, and the individual's life experiences. It is characterized by compulsive obsessions for the substance, continued use despite harmful consequences. But it is correctable, it's treatable. The American Society of Addiction Medicine defines addiction as a treatable chronic medical disease. It's treatable. So prevention efforts and treatment approaches can improve the condition. In summary, addiction is a medical condition characterized by compulsive acts despite harmful consequences, compulsions despite consequences. And in California, it is illegal for physicians to prescribe to an addict under Health and Safety Code 11156. References and resources are provided here.